You are watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Bob Odell. Dr. Odell is board certified in pain management. He is here today to discuss spinal decompression to eliminate or greatly diminish pain. Dr. Odell, welcome to the program.
Thank you very much, Randy.
Now, we've had you on the program before as the local pain expert. Now, you just got board certified.
I did.
Tell me about that. A lot to go through, I guess.
Yeah, it took an 8-hour test in New Orleans. It was quite an experience. When I passed my anesthesia boards in 1983, and little did I know at age 60 I'd be taking boards in pain medicine. But it was a good learning experience. I learned a lot. It's going to help my patients, and it's really was a good experience.
Now, I was told that pain, I guess pain management is fairly a new specialty, medical specialty.
In fact, there's no really 4-year tracks yet, like there is for internal medicine, for cardiology, for anesthesiology, for surgical specialties, and so forth. I think it's just a matter of time before pain medicine will become its own track. Some of these societies are working on that right now. It's a very, very interesting topic. It's a very, very hot issue because the reason people visit doctors is for pain. 80% of the visits are for pain.
Arizona Back Institute, the leader in Arizona. Is that right? Is that fair to say?
Well, in my opinion, it is.
Well, you guys are the busiest.
You know, we're not the Mayo Clinic, but we do some stuff that is not done anywhere else.
We're cutting edge stuff?
Absolutely, absolutely. Cutting edge stuff, effective stuff, and safe stuff.
Now, spinal decompression. And I told you on the telephone, I'm very skeptical about it. You say it works. Before we get into that, talk about, because you say you're very aggressive with pain at the Institute. What are the different modalities or approaches you're using to get rid of pain?
We use a very aggressive rehabilitation, the spinal decompression, both for the back and the neck. In addition, I do interventional pain medicine with the injections. We also have we use a new electroanalysis device, which we discussed on another show.
Okay.
Called a Synexus device, which is very, very effective.
And what is that again? Refresh our memories.
What I do is when I do my injections, I actually don't have to use steroids.
Like
I use
epidurals?
Yes. Okay. I use the electricity. And we have had great success in our program and using our protocol and getting people better. And this is, again, in conjunction with the decompression and with some of the other modalities. And not the least of which is the rehabilitation, which is extremely important.
Spinal decompression. A lot of questions about that on our website, and so we had to get the expert on the show, and that's you. Now, right before coming on, you were telling me a story about a dentist. You say coming in for one thing, and the decompression stopped it in its tracks.
We had dentists who, left-handed dentist like I am, and left-handed, and he came in. He could hardly work. He had neck pain, he had shoulder pain, and pain down his arm. I think in the C5 distribution, and he was put on the DRX, which is a decompression device for the neck. Vaxtine now makes a decompression device for the neck. For a while, it was only for low back, but this DRX device that is in the clinic works on the neck. And after 3 or 4 treatments, his pain virtually was eliminated. We had scheduled him for an epidural injection, along with the electroanalysis. He's on the table, and he said he wanted to talk to me, and I said, "How you doing?" He says, "I don't need pain." I said, "Get out of here. You don't need an injection." He's so happy, he wants to refer us 100 patients. Think about this. There's virtually no risk to the decompression. There's a little bit of risk to the injections, and we take injections in the neck very, very seriously. Okay. But with virtually no risk, the fellow's completely better. And here's a person whose livelihood depended on the decompression.
So everybody with low back pain, neck pain, should at least try it, in your opinion? That's on drug therapy, or they're the type of person that's going in for getting these epidurals all the time?
Yes, decompression has been slow to be accepted by the medical establishment, but I really believe in 10 to 15 years it'll be a mandatory requirement before surgery. Now, I mean, I'm making a prediction, may not come true, but with all the money being spent and wasted, surgical outcomes are not that good. 1/3 of the people get better, 1/3 of the people get worse, and 1/3 of people stay the same. And then, once they've been operated on, they have interference in how the low back or the neck works. When we move around, we don't get paresthesias or electrical shocks in our system because all of our vertebrae are moving a little bit to compensate for that movement. It's called dynamic functional compensation. It occurs at the spinal level with reflexes, very complicated reflexes that we'll never understand. Maybe someday they'll model that in a computer. But when a knife goes in there, even a minimally invasive surgical knife, it can mess that up. One other example of that, if somebody has a spinal fusion, within a year there is degeneration of the disc above and below. If the fusion is above L4-5. There's generation of those discs because those discs are taking the brunt that is lost with the fusion.
So spinal decompression.
The beauty
Where
of
does it play there?
Well, there's two real benefits. First of all, it's safe. There's virtually no risk.
But does it work?
It certainly does. In my experience, personal experience, 80%. There's at least 4 or 5 studies in the peer-reviewed literature that show a success rate approaching 70 to 80%.
Now, you wanted to show me slides. You say that you're going to present to a bunch of medical doctors real soon.
I have, yeah, and I have in the past multiple times.
What did you want to show me, by the way?
Well, this one slide, there was a 4-year follow-up study done by Dr. Dan Boudreau, an ex-ortho spine surgeon who started doing VAX-D.
When you say VAX-D, that's
the vertebral axial decompression.
So that's decompression.
One of our devices, yes. What happened was Dan followed his patients 4 years later. Prior to the treatment, only 30% of the people were working. Without any treatment, that would have gone down to about 7 or 8 or 9%. I don't know the exact figures, but it's of the order of single-digit people not being able to work.
Okay.
With VAX-D, 4 years later, 70% of the people were either working or they were retired and did not have any low back pain.
If it's as good as you say, why isn't everybody doing it? And I think I've asked you that before.
It's just like anything else. It takes time for acceptance. One of the other things about the decompression, both cervical and lumbar, is that it treats every level. If there's something going on at 1 or 2 levels, or let's say somebody has degenerative disc disease, it works beautifully on older people. They just need this metabolic boost to heal these discs. Keep in mind that the discs are avascular. There's no blood vessels in there. So, and yet that disc is as alive as my little finger.
So it's not going to hurt them.
It's not going to hurt
somebody in their 70s?
There's never
80s?
Absolutely, works beautifully. If someone has osteoporosis and they have a DEXA scan score of less than 2.5, then they are not a candidate. However, at our clinic we have rehabilitation and many other options, including the electroanalgesia and my injections that can also possibly help them, and we've utilized those.
How long has spinal decompression been around?
It's been around. It was invented by Dr. Alan Dyer. He was the Assistant Minister of Health in Canada in the early 90s. As you know, with their socialized system, they're having the same terrible problem with low back pain as we were, and they were trying to find a low-cost solution. So he experimented with this device and got a workable device and moved to the United States and started marketing it, I believe, in 1994, 95 here in this country.
What type of pain patients are we talking about that are ideal candidates for the decompression?
People with low back pain in general, almost everybody can very likely be helped by lumbar decompression. The reason for that is that 60 to 70% of low back pain is due to disc disease. And this device...
Like bulging discs, herniated discs?
Exactly. It really doesn't make any difference. Now, if you looked at my MRI, I probably have bulging discs and maybe some herniations. I have no back pain. But we really don't know why. The MRI presentation versus the pain that a patient has can be very different. That's one of the mysteries, and that's why we evaluate the patients very carefully and work them up and spend a whole hour talking to them about the options open to them, not just looking at the MRI. Any patient who has back pain can be helped with this, as I said before. The patient who has sciatica, pain down the leg, the patient without sciatica. Now, if somebody has just got back pain for like a week, then they should do the more conservative things for a while, obviously. But if you've had back pain for more than 2 or 3 months, it's certainly worth coming and seeing us.
What about those people that have chronic pain? They're watching this. They've been in pain on and off for years, 10 years, 20 years. How does VAX-D working there?
Obviously, it's the earlier we get somebody, the better.
Okay.
Once somebody has disc disease, a whole cascade of problems is set up, and there's positive feedback, unfortunately, that can make it worse. The discs start to degenerate, the muscle spasm, the facets become arthritic. But so the sooner we can get a patient, the better. But we've done VAX-D, we've done decompression successfully on patients who've had this for years, and they've done very, very well.
Successfully meaning what in your?
That's a good question. Pain relief greater than 80-90%.
Okay.
Maybe.
Are you ever surprised?
Not anymore.
Patient? Really?
Not anymore. I'm not. We had a lady several years ago who had so much pain. She was in a wheelchair. She had so much pain that she was screaming when she was laid down to do the lumbar decompression.
Okay.
After 20 treatments, she walked out of there with no pain. Now, you know, that's pretty dramatic, and it doesn't happen that way for everybody, but it's made a believer out of me because I've seen it with my own eyes. The other thing is, it's not just the anecdotes, it's the sheer numbers. The studies show, and my experience has been...
So in the medical literature? 70
to 80% of people get better. In fact, there's a new study that was done underwritten by Independence Blue Cross, done in Philadelphia by a friend of mine, which is going to come out in one of the major journals soon, where I believe they had a 90% success ratio. Now, I'm not sure what they define success as, but I know it was a substantial reduction in pain and a substantial functional improvement.
Yeah, help me understand that scale, by the way, the pain scale.
Well, we can't measure pain like we measure blood pressure. That's very difficult. There's no pain meter on our forehead. But what we do is ask patients to rate their pain from 0 to 10. 10 being the worst pain you can imagine, 0 being in the pain-free state. It turns out that the research has shown that for one individual, if there are 7 and then there are 3, somebody has figured out that their pain is about half. I'm not sure how they did that, but between people, it's very difficult. Like my 5 and your 5 can be different. But in one individual, following that with a pain score, it can be fairly accurate.